professionals. Beyond clinical collaboration, our research partnerships are equally significant. The Cambridge Wellcome Trust Research Program demonstrates how shared research can strengthen national health responses. During the COVID-19 pandemic, this partnership delivered vital diagnostic support and evidence to guide our response. Additionally, the US $25 million Sambai Cancer Grant Challenge Consortium is advancing our understanding of cancer genomics in Kenya, building local capacity and informing better care. Such partnerships are also looking far into the future. The Bright Kenya project, in collaboration with the Liverpool School of Tropical Medicine, will help establish local manufacturing capacity for vaccines, monoclonal antibodies, and antivenoms. This will not only reduce dependence on exports, but also strengthen Kenya's role as a regional health hub, creating jobs and ensuring sustainable access to critical medicine. We are also proud of our partnership with universities such as Nottingham, Oxford, and King's College London. These collaborations support training, mentorship, and the development of critical skills to strengthen our medical education and workforce. This is essential to Kenya as we work to expand access to quality care across the country. Ladies and gentlemen, Kenya is fully committed to achieving universal health coverage, a cornerstone of our Vision 2030 and our health sector strategic plan. Through the bottom-up economic transformation agenda, we are investing in a fully and publicly financed primary health care system, the Emergency Care Fund, and Social Health Insurance Fund that will cover all Kenyans. I remember very well when Graham visited me in Nairobi, and I informed him then that if there was one thing that I wanted to do as president was to finally work on universal health coverage. And you must be sustainable, it must be of high quality, and it must be, you said one final thing, you said sustainable, you say high quality, and you say it must be universal. Those are I have to say.
You are watching Sound Candy Talk live.
And this was an idea that was formed at King's in the mid-2020s, where we thought that for a growing continent, Africans, in a short few decades, it was important to put culinary studies and problem solving at the heart of what the next generation does. And that's what occasioned the birth of the African Leadership Center. And Mr. President, we did a survey young Africans studying at King's and who were on our fellowship program and had been on that those fellowship programs for a few years. 6 African countries first came up. Kenya rose to the top as the place that could be a continental hub where many African, without the fear, of fear itself. And my own original home, Nigeria, was on that list. It came last. Kenya has been the hub for the training of the next generation of Africans for the last 15 years. Secondly, Kenya is the place where you have multi-dimensional partnerships that will combine healthcare and technology and all forms of innovation. And many of my colleagues who study Kenyan counterparts are sitting in, as a whole, sits right at the center of it. And that's why some of the collaborations you'd hear, including ours in engaging our colleagues at the London School and other parts of the UK, would be at the top of the agenda as it should be for this alliance. And I think the third point to be made connects right back to that next generation of Africans, that we realized that fast approaching 900 million young Africans, if they're problem solving, building the elite cadre of Africans who would help lead the solving of those problems is not enough. The entry level, which, as you know, Mr. President, that all your counties have been very active in healthcare, in the training of community health care workers. We are adding value to that, and we started a conversation 2 years ago with a consortium of universities, including in Kenya as well, and in 3 other African countries, as our president has mentioned, to then begin to put quality and meaningful employment together, quality education and meaningful employment together in order to provide foundation year education that would take a young person either into foundation year, from foundation year to university, but many thousands of them into the community health workforce, and therefore a progression pathway from that into university sometime later in life. So that lifelong learning is what we're building with our partners to add value to the excellent research that has already been done. I want to welcome you. We're happy actually to be working with the Embassy of Kenya. You have brought successive ambassadors, high commissioners to Kenya, and Madam Ambassador and I met, I think it was in the city of London a couple of months ago, where Mr. Wangi was being given, the second African to be given the freedom of the city, a Kenyan, who really is the founder of Equity Bank. That's where we met, and every year our Africa Week showcases Kenya especially. So please welcome to your home away from home at King's College London. Thank you.
Thank you, Professor Fumi. Your Excellency, now we go into 2 other remarks that are very detailed in terms of the cancer diagnosis and your agenda on local manufacturing of pharmaceutical products. I would like to welcome Professor Mongon from the University of North.
Mr. President, Vice Chancellor, distinguished guests and colleagues, it is my privilege and honor to share and update you on the partnerships and friendships that we have between the University of Nottingham and colleagues throughout Kenya. The University of Nottingham has campuses in China and in Malaysia, and we act as a gateway to enable our partnerships in Kenya to access the technologies and manufacturing capacities in those countries. Kenya is our most essential partner. Our collaborations are built on deep trust and deep friendship. They are long-lasting and enduring. They're built on networks that have been built over years and that have been sustained through mutual benefit and reciprocal respect and benefit to all of our societies. But we are impatient. We want to do more. I'm so grateful to the leadership of John Guto, who has continued to make pivotal introductions to us so that we have continued to expand our partnerships throughout Kenya. We've started to explore how we can work better to transform the lives of all of our citizens. Our most valuable asset in all of our countries are our people and their health. We have no greater responsibility than to serve all of our patients. One of the challenges that we face is to ensure that all medical advances are available to all patients, regardless of where they live. That has not always been true. The University of Nottingham will partner with all of our friends throughout Kenya, from Kisii to Nairobi, from north to south, so that we can share the technologies that we are developing in partnership with our partners in Kenya. What are we beginning to do? Well, Nottingham is home to the largest number of RNA therapeutic investigators, that technology that transformed our lives through the pandemic. We are now seeking to democratize the access to RNA technologies so that they will not be just available in the global north. This will mean revolution on the long traditions of the University of Nottingham in pharmacy and pharmaceuticals. A 100-year tradition where we are making access to medicines more available throughout the world, and Kenya will be the access and the driver of change throughout Africa. I also want to acknowledge the leadership of Professor Eleanor Mitchell at the University of Nottingham, who is working with maternal and pediatric clinics across Kenya, every clinic that's available, with an MRC-funded clinical trial that will transform the survival of newborn babies. Is there a more worthy work better to share educational advances so that we learn from Kenyan experts, so that we are better prepared in the UK with the knowledge that you can impart to us? I also want to share some good news and acknowledge the support of Cancer Research UK. One of the greatest injustices is that, depending on your ancestry, you will be diagnosed earlier, you will respond more poorly to medicines, depending on your ancestry. $25 million to address that inequity, myself and the University of Nottingham. In this ambitious program, we are working with oncologists and pathologists across Kenya, from north to equip us to develop the new therapeutics, the new diagnostics that will transform lives and extend duration and quality of lives. As we look to the future, the global burden of cancer is going to shift from north to south. This work is urgent and is only possible because of the partnerships that had existed between the UK and So, Mr. President, I want to conclude by thanking you. Your presence here is a strong signal for the support for the UK-Kenya Health Alliance. Your support is pivotal and will motivate us to continue our work. I'm very thankful.
Thank you, Professor Momon. And on that note, I do invite the Vice Chancellor of the Liverpool School of Tropical Medicine, Professor David Lalo, with whom BioVax get to their first vial by 2027. Thank you, Your Excellency.
Thank you, and it's a real pleasure to be here. And Your Excellency, thank you very much for being here and gracing us all with your presence. ASTM is an unusual organisation in that we focus almost exclusively on improving health outcomes in disadvantaged populations globally. And almost 95% of our work is actually undertaken in low middle income countries. We've had a very long association with Kenya. The first project that I could find that occurred in Kenya was over 100 years ago. And so this is something that's really close to our heart. And of course, if we're going to achieve that increase or improvement in health outcomes, that can only be done in partnership, as others have indicated we have. We've had a major partner with Kenya in Kisumu in the west of Kenya for over 20 years now. That partnership has actually made enormous advances and impact on the management of malaria, from first bed net studies to the understanding how you treat malaria in pregnancy to actually implementing the vaccine. And out of that partnership, I think, has been a real step forward in how we manage malaria around the world. And the impact of the research done in Kenya is actually global. The other side of that, I think, is the really critical issue of how scientific capacity is strengthened and developed further. I first visited Kenya, actually the Kenya unit on the coast, in 1989. And to have witnessed the explosion in scientific talent in Kenya over what's now quite a long time has been absolutely fantastic. And we in LSTM are really committed to continuing to support that scientific talent in the best way, both through education and through collaborative research. More recently, we've had a focus on snakebite. In the last 10 years, we've been coordinating and collaborating with KIPRI. We supported the development of snakebite research in Kenya. We've supported the development of a herpetarium where you can now actually manage snakes and extract venom for use in your own products to treat snakebite. I recognize that snakes are not always a topic that's popular for many Africans. And to see the response of people as they go around the herpetarium in Kipri has been quite fun. But it is a really important issue. And it's led to our most recent partnership, which is now about a year old, directly with the Ministry of Health, to look to see how LSTM can support the development of your own antivenom capacity, so that Kenya can develop antivenoms and not be dependent on imported antivenoms. We've been very privileged to actually welcome both of your PSs to Liverpool. We'll but capacity to develop their own, to the third earlier this morning with the Ministry of Health. And that's a program that's called the Bright, which is essentially about how logically about the importance of education, but in LSTM we're thinking very carefully about what are the new models that you need for health personnel. The model of taking people out of healthcare and training them for a week is not acceptable anymore. We need to think about how we can train clinical staff of all cadres in service, how we get the right courses for those individuals. And I think also how we can train the next generation of clinical academics, clinical academia, people that are both researchers is in a crisis at the moment, and that crisis occurs all over the world. I'll finish also by saying that partnerships are not one way, and this is very much as a two-way partnership. We've had a reasonably long-standing now relationship with community health teams in Homa Bay, and exchanges by which community health teams in Kenya. The reality is that using community health workers to deliver healthcare and prevention advice is way more advanced in Kenya than anywhere in the UK. And your colleagues when they came over, were really quite polite, but quite frankly horrified by how backward community health delivery was in some areas of Liverpool. And so I'm absolutely passionate that we can learn a lot in the UK from the experiences of Kenya as well, which makes it a true two-way partnership. So I've just finished by thanking you all for coming. Thank you particularly for Your Excellency for being here today. This is a really important initiative for LSTM, and I hope that our ongoing discussions will continue for many years. Thank you.
Thank you, Professor Lalo, and Your Excellency. I have to look at them kindly because when you appointed me to this position, Your Excellency, I was actually at LSTM on this program called Bright, that 3 months into that time, we will be signing the MOU today, and then we will move from next week to begin that process. Your Excellency, last we will have an address from, again, one of your friends, Professor Lord Graham, who is from the King's College, London. And he'll give his address and also acknowledge one of the guests that we have, who is also another friend of yours, Your Excellency, Professor Orama, who is the President and Chair of the Board of Directors at the Afri-Exim Bank. Welcome, Lord Graham.
Your Excellency, President Ruto, Principal Secretary Aluga, Principal Cabinet Secretaries, High Commissioners, distinguished ladies and gentlemen, and also President Orama, Benedict Orama, my friend who we met in Abuja a few weeks ago. Welcome, all of you. So all protocols observed. Caribou. Welcome to the United Kingdom. Welcome to London, and welcome to King's. It's a particular personal honour to be giving this address in front of such a distinguished audience, particularly President Ruto. We were discussing earlier, we first met on a sad occasion for this company, for its country, which was the funeral of our former Queen Elizabeth II in September 2022. And that was the first time that you and I discussed the founding of the Kenya-UK Healthcare Alliance, KUKA, that we'd founded a year earlier at the Royal College of Physicians here in London as well, but also how we could continue to build on this partnership. I then visited you in the State House in Nairobi in March the next year, 2023, where we built upon this partnership and how to discuss how we supported universal healthcare and universal health coverage with a particular focus on non-communicable diseases such as cancer, and also healthcare education and training. And around that time, following my visit to the Lake Region Economic Bloc and the governors down there, if you recall, we partnered with Kisii County and Kisii University, but also Maseno, Masindi Muliro, Egerton, Bomet and Kibabi universities. And at that time, your cabinet signed a memo, if you recall, to support the development of a centre for excellence in healthcare education and training. and we continue to work on that project with you. Therefore, it's a particular honour of mine today to see the renewal that you signed with the Prime Minister in number 10 of the Kenya-UK Strategic Partnership that runs now from 2025 to 2030. And the opportunity for King's College London today to enter into a formal partnership with you through KUKA, which is the MOU we'll be signing very shortly. So the WHO, the World Health Organization, predicts that by 2030, which doesn't seem so long away as it did 5 years ago, that 40% of the global shortfall in healthcare workers will be in Africa. That, coupled with the rise in non-communicable diseases, cancer, diabetes, stroke, which due to demographic change and other factors will be the biggest cause of mortality in Africa by 2030, this health partnership is urgent. By sharing expertise across our two nations, we need to reimagine a healthcare system that does three things. One is sustainable in terms of money and people. Two is of high quality. And three provides universal access. Healthcare systems in the world trade off at least one of those, if not two. And that's not a position that we can accept. King's College London has a proud tradition, as President Kapoor mentioned, of excellence in healthcare, training and research. And just to promote ourselves a little bit, Kshitij mentioned Florence Nightingale School of Nursing. And actually this year, the School of Nursing, Faculty of Nursing at King's College London was ranked #1 in the world in the QS rankings, an extraordinary achievement. We're also top #1 or 2 in the world for mental health, psychology or psychiatry. Top 5, it goes between 2 and 4 in dentistry, and top 10 for the whole of medicine in the world. So why do I say that other than just to be very proud of the university that I now work for? Is that by signing this MOU today, King's College London and other partners within KUKA are committing to collaborate with you and the people of Kenya to not just share our learnings, but to learn from you as friends and partners and countries to try and find solutions to these very pressing challenges. In partnership with the University of Nairobi, as Funmi mentioned, King's founded the African Leadership Centre, the ALC, in 2010, so 15 years old, as you said. Based in Nairobi, the ALC has a number of key programs in areas such as peace, security and development that enables students to pursue a master's in global leadership and peace building here at King's. The ALC fosters a value-driven, intergenerational community of transformative African leaders. And with the signing of the MOU today, we can now begin discussions at pace as to how we can integrate health leadership into this centre to achieve maximum and rapid impact in the healthcare space. The first strategic partnership between Kenya and the UK was signed in 2020, and that led to the foundation of KUKA in 2021, as I mentioned. And now that our two nations, the Republic of Kenya and the United Kingdom of Great Britain and Northern Ireland, have renewed this partnership from 2025 to 2030, I look forward in anticipation to what our next productive and impactful steps will be. Asante Sana.
Thank you, Your Excellency. The King's College London had invited Professor Orama because of the centers of excellence that they are developing in Africa. And they have already concluded one in Abuja. And I've been in conversations, Your Excellency, with Professor Lord Graham, that the next center of excellence should be in Kenya. And on that note, Your Excellency, with your indulgence, I would like, with your permission, Your Excellency, to invite Professor Benedict Orama just to make a few remarks, Your Excellency. Professor Orama.
Your Excellency and dear brother, Dr. William Ruto, the President of Kenya, Vice Chancellor, King's College, London, professors, distinguished ladies and gentlemen, Principal Secretary, dear brother. It is indeed a great pleasure to be here with the delegation from Kenya, led by His Excellency President Ruto, to discuss something very important and dear to us and dear to me personally, how to improve healthcare in Africa. President Ruto knows we've discussed this extensively, privately and officially in Kenya and elsewhere. And I'm very, very pleased with the kind of partnership Kenya is building with King's College, because it aligns strategically with what we are doing with King's College London also and King's College Hospital. Essentially, to begin to take our destiny in our hands, to make sure that we develop the same kind of quality healthcare facilities in Africa as exist anywhere in the world. We worked with them and put one up in Abuja, and we thank King's for the partnership in doing so. Together, we've concluded an investment of $300 million and with a target of $750 million, because that facility also includes research and training. And I'm very, very, there's a lot of work is being done of African created a life sciences foundation with an endowment fund of $600 million, of which Afresimac has already donated $75 million to support research in that direction. And we hope that we will work with Kenya and King's College in this partnership, KUKA, so that together we will not only do the work that you have agreed to do together in Kenya, but extend it to other parts.
Thank you so much, Professor. And now may we all be upstanding as we welcome His Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto.
Thank you very much. Let's take our seats. Good afternoon, everybody. Kenya and the United Kingdom share a long-standing strategic partnership anchored on 5 key pillars: mutual prosperity, security, sustainable development, climate action, and people-to-people connections. Today, our collaboration is alleviating health budget cuts across the pillars and symbolizes this partnership at its best. The Kenya-UK Health Alliance is a flagship model of what our countries can achieve when we bring together expertise, resources, and shared values. Through the alliance, our 2 nations are delivering meaningful collaboration in research, clinical excellence, workforce development, and innovation, and helping to strengthen our health systems and improve lives on both sides. The alliance has already brought together renowned institutions in both countries. Harold Research Hospital, the University of Manchester, and SCTNEWS Foundation Trust has supported the deployment of Kenya's first mobile endoscopy unit to screen for esophageal cancer. Other initiatives include building emergency medical training in Kisii and programs supporting breast cancer patients with life-saving counseling model. I'm also proud of the collaboration between King's College London and health professionals in Kenya to establish in Mombasa. This partnership has facilitated remote consultations, training via digital platforms, and knowledge exchange to address the specific challenges of diabetic food care. Such projects illustrate the Kenya-UK Alliance role in advancing local capacity and delivering care that is tailored to our people's needs. Importantly, these collaborations are sustainable as they are based on building Kenyan expertise. For example, thanks to the partnership led by the Alda Hay Children's Hospital, more than 340 pediatric heart surgeries have been performed in Kenya, with the latest 43 being carried out entirely by Kenyan professionals. Beyond clinical collaboration, our research partnerships are equally significant. The Kemri Wellcome Trust Research Program demonstrates how shared research can strengthen national health responses. During the COVID-19 pandemic, this partnership delivered vital diagnostic support and evidence to guide our response. Additionally, the US $25 million Sambai Cancer Grant Challenge Consortium is advancing our understanding of cancer genomics in Kenya, informing better care. Such partnerships are also looking far into the future. The Bright Kenya project, in collaboration with the Liverpool School of Tropical Medicine, will help establish local manufacturing capacity for vaccines, monoclonal antibodies, and antivenoms. This will not only reduce dependence as a regional health hub, creating jobs and ensuring sustainable access to critical medicine. We are also proud of our partnership with universities such as Nottingham, Oxford, and King's College London. These collaborations support training, mentorship, and the development of critical skills to strengthen. This is essential to Kenya as we work to expand access to quality care across the country. Ladies and gentlemen, Kenya is fully committed to achieving universal health. Ladies and gentlemen, Kenya is fully committed to achieving universal health coverage, a cornerstone of our Vision 2030 and our health sector strategic plan. Through the bottom-up economic transformation agenda, we are investing in a fully and publicly financed primary health care system, the Emergency Care Fund, and Social Health Insurance Fund that will cover all Kenyans. I remember very well when Graham visited me in Nairobi, and I informed him then that if there was one thing that I wanted to do as president was to finally work on universal health coverage. And you have mentioned something very fundamental here. You have said it must be sustainable, it must be of high quality, and it must be, you said one final thing. You said sustainable, you said high quality, and you said it must be universal. Those are the three things I heard you say. And I want to confirm that that is the template upon which we are working on universal health coverage in Kenya. And Dr. Oluga here has clarity from me on what needs to be done. You've just heard the instructions from Graham there, sustainable, high quality. The instructions from Graham there, sustainable, high quality, and universal. All right? And it is one thing that I purposed that we must achieve. And I want to give you some good news ever since you left, apart from what we have done with community health workers, which we changed the nomenclature to community health promoters. We now have 100, and their stipend is shared between the national government, and the now of the city of Nairobi will tell you he has 7,840 community health promoters in Nairobi. Just one count. And it is the infrastructure that supports health at the very bottom of the pyramid. Every community health promoter has a couple of homesteads to think about. And apart from building that solid base and making sure that these promoters are people who have been trained on the very basics of what to look out in communities, especially when we are trying to attend to them on matters health. But we have also built a bigger ecosystem now. We have transitioned what we had as health. But we have also built a bigger ecosystem now. We have transitioned what we had as just to % for health insurance of their incomes, while the much more endowed members of our society were paying less than 0.1% for health insurance. We decided to make an equitable program to create equity and to create uniformity. So everybody today in Kenya pays 2.75% of their income. For the vulnerable members of our society, health insurance has come down from 10% to 2.75%. For the rest of us, it's gone up from 0.1% to 2.75% of our incomes. And by so doing, we have created sustainable funding. You know, we can now predict with much more accuracy and clarity how we are going to take care of our health infrastructure. In fact, just to give you numbers, by the end of this year, when we are doing the first anniversary, health insurance will pay for 3 times more people than it has done in the past. And we have managed to bring into the health insurance space in health, on health insurance a year ago. We now have 24 million people. In the last 1 year, we have brought on board another almost 14 million people. And just so that you know how 50,000 on average between and our health. Many Kenyans are now realizing the importance of being in that platform. And we are confident that we will be able to reduce out-of-pocket expenditure, occasionally become part of health delivery because there wasn't a predictable way of making it sustainable. You find families selling their assets, selling their land, selling their livestock, selling their wares because they want to go and pay for somebody in hospital. We want to make that a thing of the past. On making it high quality, my friend Sakaja here will tell you that we are now working with them on how to have equipment in our hospitals and have those equipments in a way that doesn't strain our budgets, that we've now worked with manufacturers for them to deliver equipment, and we pay on a program of pay for service or fee for service, so that we don't have to buy an MRI, for example, or a CT scan for a hospital. A CT scan is available at the hospital, and we pay for as many times as we use it. If for one reason or another it breaks down, it is the responsibility of the manufacturer to repair it. We will wait. We will pay nothing until they repair it, and then we continue using it. So to create that space, and also to make sure that there are health commodities in our hospitals, specifically to make sure that health is of such quality that it deserves, or our citizens deserve. I'm very happy that President Orama and Afrexim Bank are working on how we can now enhance that quality, make sure that we have centers of excellence on matters health. And organization, you are my friend at the very least, so that we can have one in Kenya. And thirdly is to make it universal, so rather than the public sector stepping in for the people who cannot afford. And that is the structure we have built, that while those who can afford can pay 2.75% for indigents, and those who cannot afford to pay, the government of Kenya will step in, because we must make it universal. It must be available for everybody. So I am very happy that we are making this progress together. And this consortium of universities here in the UK, working with us in this Kenya-UK Health Alliance, is a step in the right direction and has the support, the endorsement of my administration. And you can count on my support and count on my leadership as we work on this together. On behalf of the government and people of Kenya, I express my very sincere appreciation to all the members of the Kenya-UK Health Alliance, to His Majesty's government, and to all our partners for your steadfast support. This collaboration is central to our national development goals and to the health and well-being of our citizens. I reaffirm Kenya's commitment to deepening our partnership with the UK in health. Looking forward to welcoming you all to Kenya as we continue this shared journey of collaboration and progress. And I thank you very much.
Thank you, Your Excellency. So now we will welcome the University of Nottingham and King's College London, the Vice Chancellors, and Your Excellency, together with the Vice Chancellor, if you could just, with your indulgence, sir, just stand behind them so that as they sign. Okay, please. The High Commissioner, Kenya's High Commissioner to the UK. Thank you, Your Excellency. While you're still standing, we would like to have just recognize again for the gifts to be brought, just for recognition of some of the work that has happened.
Welcome back and thanks for staying with us. This is Daybreak. With me in studio on my far right is Professor Lukwaya Tuole. Good morning, Prof.
Morning.
Much appreciated. Your presence is valued.
for having
Dr. Danvas Makori, good morning.
Good morning, Abdul. Good to be here.
Good to have you as well.
Thank you.
Professor Peter Kagwanja, good morning.
Good morning.
Lovely having you.
Thank you.
Sheila, good morning.
Good morning.
Much appreciated. Dr. Ojuang, good morning.
Good morning, sir.
And thanks for your time as well.